To get things started, I think one of the common questions that we receive is when there is no cause and no family history, how and why do people develop FTD? It's an excellent question, and it's one that many scientists are working very hard to try to understand. Brooke, do you want to discuss?
Hello, everybody. I'm glad to see so many familiar faces. This is my second time coming to this conference and looking forward to hearing all of your questions. I currently work as a genetic counselor and have counseled many families and also have personal experience with this. I want to highlight that I think there are so many people here today out at the booths who can answer questions, as well as us if we don't get to your question today. But overall, I think your main question was just sporadic FTD and what we know about it.
What causes it? Multifactorial?
So my answer would be, we don't fully understand that, or we would have a lot more options for treatment. And that's where we're getting to the root of why the genetic piece, whether you do have a family history of this or do not, the genetic piece can be very helpful for both populations. The main goal is when we can understand the cause of a condition, then yes, we can get answers and provide treatment options. So I don't have a great answer as to what causes sporadic FTD outside of we think it's a combination of maybe multiple genetic factors, environmental exposures, et cetera. So it's multifactorial, at least as far as we know at this point.
And as far as multifactorial inheritance goes, when we talk about environmental factors, that's everything from in utero, so before you're born, through your childhood, through midlife, through later years. There are lots of other different lifestyle choices and factors that can influence whether or not you're at greater risk to develop FTD. There's a lot of research out there. Certainly Penny Dax and Caitlin Casaletto are experts in lifestyle influences on developing FTD. So I would definitely defer to their greater expertise. But little things are still within your control. There's evidence to suggest things like diabetes or hearing loss can help contribute to developing dementia in general, and FTD as well. So controlling your blood sugars, having a healthy diet, exercising, because obesity is also linked to an increased risk for FTD. So there are factors that are in your control, and of course there are many factors that are out of our control, but we can take steps to mitigate that.
Now I can see you better. It's very blinding, so if anyone does have a question.
Yes,
We see lights.
Has a question now, please raise your hand and a microphone will come to you. Once you have...
Yes, hello. I am curious to know if a family member diagnosed with FTD has already passed on, has the ship sailed for genetic testing, or is that something that can still be performed on family members?
Oh, that's much better.
So the ship has not sailed. There are options, but I think it's going to be dependent on your family situation as to how you want to approach that. Number one, we do, as genetic counselors, try to gather as much information as we can on an individual and a family who has been diagnosed. So, maybe if it was years ago, there was not an autopsy performed, but if by chance there is any ability to obtain that information, we would encourage getting as much medical information, even if it's just medical records from that family member, to further clarify what specific type of FTD or dementia maybe was being clinically considered and what other methodologies were used for that diagnosis. Was there a brain MRI performed? Was there a PET scan? Was there any biomarker testing done? Many times for someone that's been diagnosed years and years ago, we may not be able to obtain that information, but I would start there, at least if there is any piece of medical information that we're able to obtain. Other family members definitely have access to testing, but it does get complicated. Number one, does anyone else exhibit symptoms in the family? Is there a family history that can help pinpoint what's going on? If someone is very, very motivated and just wants testing, that's an option, but we definitely would talk through things like, what are the risks of getting a test result for someone who is not exhibiting symptoms? Just like if you go and get an echocardiogram and find an abnormality in your heart, that's going to prevent you from being able to get life insurance. A piece of genetic information that's positive can also prevent you from being able to get life insurance, long-term care disability insurance. So there are some conversations I think to be had, but it's not that you are totally out of options in terms of testing within a family with that family history. The other complicating factor would be that we can test someone who is not exhibiting symptoms, but a negative test would not be proof that there's not a genetic factor in the family. It could be that that person that's unaffected and tested just did not inherit whatever caused the symptoms in the family member. So there are definitely options, and it's worth, reaching out to any one of us here if we can help. Or, sometimes your family member's neurologist might have a good referral of who to speak with in your local community. There are a lot of online resources to discuss these options for people who may be at risk but don't know because their family member wasn't able to be tested before they passed away.
Great, thank you, Brooke. We have one, we'll take this one in the front middle, and then we have a hand in the back as well once the mic goes.
Have you seen any real-life examples of people with genetic FTD that have lived a long life without developing any symptoms? Or is it pretty much if you have genetic FTD, you will develop symptoms at some point in your life?
I do know a couple of people who are in their advanced years who have a pathogenic variant and are completely asymptomatic. It can happen.
And I would say that answer is very specific to the type of gene that we're looking at. We don't have a lot of that very specific information to give you percentages and odds for some of the genes because they've only recently been identified to be associated with FTD. But those are hopefully pieces of information we'll gather over time as more research is performed. And so it's really gene specific and family specific.
Great, so I'm gonna head to you on this side while the mic is going back.
Thank you. This is a generational genetic FTD question. So in the third generation of this family, 2 out of 3 siblings have been genetically tested and have the GRN variant. The third sibling passed away from melanoma, so no opportunity to test. His children want to know whether they are 50% at risk, as are their cousins.
Do you want me to talk? So based on the information that you shared, it sounds like the genetic cause in the family is known?
Yes.
Okay.
It's the GRN,
Oh, yeah.
BVFT.
Okay. So yeah, in that situation, they can certainly get tested. We would assume that the aunts and uncles and the cousins have the same GRN variant, and if their parent who passed away had that, I'm not saying this very well, but we would look for the same cause in that person that's in the aunts, uncles, and the cousins. Yeah.
So I don't think you can say it's definitively 50% because we will never know if their parent had GRN, but with the family history, we would say, oh, it's a 25% chance, assuming the odds that the sibling, their father or mother, had it, and then another 50% chance that they then inherited it. So bottom line is they're eligible for testing and would be at somewhere between a 25 to 50% risk.
And that would be more reliable testing because we have the family genetic information. So.
Great, so I have a question in the middle here, and then I'll go to that side.
Thank you. I've got a question about the C9 gene. If you go to the doctor and they see you have a family history of, say, ALS, shouldn't that be a trigger to keep an eye on you genetically for FTD? And I ask that question because I don't think enough doctors know about it. And is there a way to get it into, say, an EPIC or a Cerner environment as a trigger, simply a trigger to ask the question?
The short answer is yes, that should be, but the reality is that it's not necessarily going to be something that a provider is aware of. I mean, that's why conferences like this are existing, to try to raise more awareness so that clinicians who maybe haven't interacted with a family with C9 or F72 will learn over time, what the implications are. My understanding, and there's kind of different numbers out there, but basically for people who have the family history of ALS, FTD, anyone that has ALS supposedly there's maybe around 15 to 30% chance they will go on to develop FTD. And then on the reverse, anyone who has FTD has maybe a 15% chance to go on to develop ALS. It's hard because whatever your initial diagnosis may be, oftentimes that diagnosis itself, so FTD alone or ALS alone, are such complicated diagnoses that that individual may never go on to see another clinician that would specialize in the alternate version of what can result from a genetic form of ALS FTD. So yes, it should be something people would be aware of. It's something we want to raise awareness that if you have ALS in your family and you have some type of dementia, that could be because of an underlying genetic factor. But the reality is we're not quite there yet, that's an automatic thing that people are following up on. So.
And I do want to just comment that this is something that AFTD is working hard on. In fact, tomorrow we'll be hearing from 2 clinicians, one who specializes in the ALS and one who specializes in FTD, and their efforts to break down the silos between those 2 clinical specialties. So you'll hear more about that tomorrow.
Great. So we'll take a question on this side.
I just want to thank you first for being here today and including this as part of the conference. I'm a physician and also a caregiver, and I do appreciate the last question that gentleman asked, because this is truly a journey in my own understanding and helping patients of my own. My specific question is related more to inheritability as involved with sex chromosomes. For instance, if a mother's side of a family had Alzheimer's, the women all had Alzheimer's, and let's say a son developed FTD, is there any link between the Y chromosome or not transmitting any genes? Maybe his sons are not at risk, but his daughters would be?
Great question. And I think, again, it goes to what specific gene are we looking at or group of genes are we looking at? There are a lot of different genetic testing options out there, so you can find general dementia panels, FTD specific panels, ALS specific panels. Majority of those have more of the autosomal dominant genes, which is what Kim spoke most to in her talk. There are a few X-linked genes, so UBQLN2. There are others that exist, probably not the top, I guess, positive that we would see. Some of the other ones that were mentioned are more common, and those are just dominant, meaning both males and females have 2 copies of those genes, and it's a 50-50 chance as to which copy they pass on. So there can be X-linked families, and the answer is yes. There's a chance that could occur in a family if there's an X-linked gene that, then someone in the family didn't inherit that X-linked gene.
And I would also just say that I would be curious about the accuracy of the diagnosis of all of the maternal relatives with dementia or Alzheimer's. It's possible many of them had FTD as well. So.
Thank you. So we'll hit a question in the middle and then over to the...
If somebody tests positive, does that affect their ability to get health insurance?
That's an excellent question. There are laws in place. There's the Genetic Information Non-Discrimination Act, which, did I say that right? That protects your health insurance and your employment, but it does not protect you for life insurance, long-term disability insurance, or long-term care insurance. Those are loopholes in the law, the Genetic Information Non-Discrimination Act. There are other entities that aren't covered. So if you work for a company with fewer than 15 people, GINA does not protect you. Also, if you receive health care through the Indian Health Services, you're not covered. And if you're a federal employee, you are also not covered under GINA. So you do have to be careful and cognizant about how and when you share your genetic information. And we do have a really wonderful webinar that we did last April about navigating the social and legal challenges in familial FTD that speaks to a lot of the issues of how people can prepare for genetic counseling and genetic testing, and how they can protect themselves as well as possible against any potential genetic discrimination.
Thank you.
Thank Thank you. So we'll go over to this side of the room.
Has there been any link identified between Parkinson's disease and FTD?
You go ahead.
Sure. So the complicated issue with FTD is that before we ever did genetic testing, people for a very long time have been getting a clinical diagnosis. So you go in, see your physician, maybe some imaging studies are done, you get the health history, behaviors reported, information like that. And also maybe a movement disorder specialist is involved and has noticed Parkinsonism in a family. What we're noticing is now the genetic pieces of this are, being put into the puzzle. There's a very wide spectrum of FTD where some individuals, like we've already talked about, may develop ALS or may have had ALS first and then develop FTD. And I would say it's similar with Parkinsonism or Parkinson's. C9 specifically, we can see Parkinsonism as a clinical feature of that spectrum. So I think the answer is that there can be some overlap between the clinical neurodegenerative diagnosis and then the underlying genetic factor that's identified. So maybe one specific genetic subtype may have multiple clinical features that can be seen that run the spectrum from FTD to Parkinsonism. I don't know if that answers the question. So there can be a tie that's a genetic tie that can cause both symptoms or diagnoses within a family.
And Parkinsonism is one thing that would be asked about in the family history because we know that progressive supranuclear palsy and cortical basal syndrome can present with Parkinsonian features and can often be mistakenly diagnosed as Parkinson's. So because there's some overlap in what we call the phenotype or the clinical features that are being shown, sometimes it's a misdiagnosis, which again, when I was speaking to seeing these related disorders clustering in a family, that's sort of taking into account the fact that there could be misdiagnoses. Okay.
Great. So we'll take a question from the middle there.
I'm interested in learning more about DNA banking. Could you talk a little bit about that, how it's done, where it's done, or who to contact to find out more about it? And also the fee-based structure. Is that a one-time fee, or is the family locked into monthly payments for the rest of forever?
I can speak to that.
Thank you.
So DNA banking is a really useful tool. Speaking to the fee structures, there are several different companies out there that offer DNA banking. It can range in price from about $200 up to several $1,000s. It's a one-time fee. I would not encourage anyone to spend several $1,000s on DNA banking because that's exorbitant. So basically, they take a sample, they isolate the DNA. DNA is incredibly stable, so it can be kept for decades and still be used for testing. It's very similar to opening a bank account. You deposit the DNA sample. It's a good idea to have a joint account, so there are at least two people on the account. That way, if one person is no longer available, somebody else can withdraw that sample. And then you can use that sample for testing in the future. There used to be a laboratory called Prevention Genetics that offered DNA banking services, and they've discontinued this service. They are still maintaining all of the DNA that they have banked, but they're not accepting new samples. A group of genetic counselors and I have been researching other possibilities, and we have found a few options, and we're working on talking to some other laboratories about perhaps expanding their programs to allow for greater DNA banking opportunities. So right now it is a little bit of a challenge, but there are still some labs where we can send DNA samples for banking. Did that answer all aspects of that question?
Great. So we have a question on this side of the room over here. Yep.
Hi. If I'm tested and find out that I have this GRN variant, should I tell my kids and have them tested or not worry about it?
So oftentimes, at least our job as a genetic counselor would be to help facilitate how to best have that conversation with family members. It's an individual decision. There are definitely, recommendations for those who wish to share with family that we can help create maybe a short one-page document that you would be able to share with close and extended relatives so that you don't have to have the conversation over and over about what testing you went through, and at least that raises awareness within the family, and then maybe more specific questions come directly to you or whoever was tested in the family. From families that I have worked with, and even our own personal experience in our family, it runs a gamut from people who really would like to have the information and are reading that letter that you send to them and want to have a conversation and want to get tested, to people who completely ignore the letter or ignore the information and just are happy to go about their lives without considering getting testing. So it's a personal decision to share information and also to get tested, but there are a lot of resources to at least get the information to families so that those family members can make a decision on whether they would want to go the route of testing or not.
I think one other factor to consider is that research is highly focused on GRN specifically. So I think it is worthwhile to share the information with your relatives, with your offspring, because that gives them a path forward. They can choose not to get tested and not know their status, that's fine. Or they may want to participate in research. Maybe they want to be able to access some of those treatments that are being developed. So I think it's now more than ever really important to try to share that genetic information across your family, because there's a lot of work being done to develop a treatment.
Thank you. There's another question on this side.
How quickly is the technology changing in the genetic world? If, say, a person was tested to see if they had any of these genes within the last 5 years or 5 years ago or 10 years ago, and it came back negative, should they consider getting retested, or what would you recommend they do? Do they let it go? Do they relax or not?
So I always tell anyone that I meet with or encourage them to reach out even annually, just because there are such rapid changes occurring in terms of gene discovery or maybe what's even on a genetic testing panel. You can imagine like C9, one of the top cause in Caucasians for ALS FTD was only discovered in 2011. So there are many people who had testing years ago that wouldn't have had that gene even looked at. Also, technology-wise, there are repeat disorders, so a change in the way that the genetic code is repeated maybe too many times, that for C9 specifically, but then for other genes, they're spell checking the gene and trying to see if there's any missing or extra letters or pieces of the gene that have been deleted. For that technology called sequencing, they used to only look at certain parts of the gene called exons. Now, some technology is able to look a little more closely at the full gene, so-called whole exome or whole genome sequencing. So it may be that the technology used for a family member only looked at the subpart of the exons as opposed to exons and introns. So yes, things change over time, and it's very difficult to know what was done and what might be available that's newer and more appropriate. So definitely reviewing those options with a clinician or someone that you are able to have review the results of your family member or your own results, and make a determination of, hey, is there any new testing that's I'm eligible for or should be tested for?
I also want to just comment that this is one of the reasons that long-term follow-up with your genetic counselor is important, because the testing and the technology and our knowledge does change. And this is also one of those things where it's really important for you to have your own genetic results. What was done 5 years ago? Because that will be the question that your genetic counselor asks you if you happen to see a new one, which you might. They need to know what's been done in the past to be able to guide you for what your options are moving forward. So I encourage everyone, if you've had genetic testing, make sure you have a copy of your genetic testing report. It's important to know what lab did it, what methodology they used, what genes were tested, and how deep was their sequencing, how detailed was it. Okay.
That brought up one other thing that I thought of. So some people have a genetic testing report, and I've had people come to me, we review the report, they were told, oh, it's normal, but technically there's a variant. So something identified in one of the genes that we don't fully understand at the time. Oftentimes it makes sense that a clinician would say, oh, we didn't find anything definitive, But what needs to happen is that variant should be followed within a family, because eventually that's going to be reclassified to actually being pathogenic or benign. So getting that answer for a family if that's your situation. And then also for things like C9 or other repeat disorders, over time there have been studies that kind of show that the interpretation of the results, so how many repeats were in the gene, there's kind of a difference of what is considered abnormal, and there's maybe like a gray zone where some people with this type of a result do go on to develop symptoms, but it's less likely. So having someone review that information with you and making sure that you had an absolutely negative result versus a variant versus a borderline result is important.
So in summary, it's always worthwhile to follow up with your genetic counselor to see if there's new information that's come to light about your testing. Okay?
So we're reaching the end of our session, but as Kim said earlier, we will be around today and tomorrow. So if you have, we can take that last question, and then if anybody else has questions, feel free to seek us out in the next couple days.
I was going to try to wear a bright pink blazer tomorrow, so you can find me. Hopefully, maybe you'll wear one too.
I'm not in black. I'm in black all day. Did you see another question?
Yeah.
For families that have FTD and ALS and they want to do brain donation or the DNA banking, would that be done through the same organization? Or how do you handle that currently, or how would you suggest a family look into that?
Site specific, I would say. Yeah. It depends where you are in the country, what, research program you're a part of. Does that research program provide that option? But I think any of us would be happy to walk somebody through that and try to help with local resources.
And AFTD's helpline has some resources specifically for brain donation. I do want to just mention postmortem examinations, brain donation often doesn't include genetic testing. So if that is your future plan, you need to add genetic testing onto that. A lot of families think that that's part of that post-mortem examination, and it isn't. So just FYI.
Well, thank you, Brooke, and thank you, Kim, for being here, and thank you to everyone in the audience who was asking these thoughtful questions. It's really great to have you all here and understand what you are interested in knowing about. And so, as I said, if you need resources, you can come to the AFTD booth or the Registry booth, or seek one of us out in the next couple days.
Thank you. Great question.
Thank you.